Hi, my name's Christine. I'm going to be the nurse that takes care of you today. Okay? All right, I'm going to pull the curtain, wash my hands, do a complete safety check. Can you verify your name and date of birth? Okay, wonderful. Do you have any known allergies? No? Okay. I'm going to get a set of vital signs now. All right, what brings you to the hospital today? Okay, so you've had some chest pain and some shortness of breath that's been worsening overnight. Okay. Oh, and you had ankle surgery about 3 weeks ago, and you noticed some pain in your right leg and swelling. Okay. Have you been taking any medications? Yeah, so gabapentin, Tylenol, aspirin, and you started back on your birth control pill. Okay. You decided to stop the aspirin because you didn't think you needed it anymore. Okay. All right. So I'm going to do a pain assessment, a cardiovascular and respiratory assessment on you now. Okay. So can you tell me when the chest pain began? Okay, so yesterday you noticed it and it got worse overnight and you became short of breath and decided to come in. Perfect. Okay, what makes it worse? Walking around. And what makes it better? Rest. Okay. Can you just describe the pain? It's sharp and it radiates up to your right shoulder. Okay. And the severity is about 10. Okay. When did you first notice in your right leg the pain and the swelling? And that was about 2 days ago? Okay. And it got worse it felt crampy and it got worse when you were walking around. Okay. And what made it better? Just rest. You tried some ice. I see. Okay. And that severity is about an 8 now. Okay. Do you have a history of heart problems? No. Do you have any high blood pressure? No. Okay. Have you ever noticed any swelling just in your right leg? Okay. Have you ever had this chest pain before? Anything like this before? No? Do you feel any chest tightness? No. Have you ever had any breathing issues? No. Okay. Have you ever had a blood clot before? No. Do you have high cholesterol? You do? Okay. How's your diet? You eat a regular diet? You try to watch it? Yeah. Okay. Have you gained any weight lately? Oh, you have? Since the surgery you feel like you have? Okay. Do you drink any alcohol? You do? On weekends? Okay. When was your last drink? Just a couple days ago? I see. Okay, and then how often do you drink? Okay, you drink like just on weekends. And how often, like how much do you usually have? Like 3 to 4 glasses of wine? Okay. And do you smoke? You do? Oh, okay. And how often do you smoke? About 3 cigarettes a day? Okay. And when did you first start smoking? When you were 21? Okay, and you're 40 now, so it's been about 19 years. Okay. Do you use illicit drugs? No. Is there any family history of high blood pressure? Yes. Is there any family history of stroke? Oh, your grandmother died of a stroke about 5 years ago. I'm sorry. And is there any family history of a heart attack? Yes. Your grandfather had a heart attack about a year ago. Okay. Is there any family history of obesity? Yes. Okay. Now I'm going to listen to your heart. Is that okay? Great. Okay, we're also going to do a CT scan and draw some blood work. Is that okay? Great. Okay. Now we're going to do a respiratory assessment. Do you have any history of respiratory illness? No. Have you experienced any shortness of breath like this before? No. Okay. Do you have a cough? No. Any family history of respiratory illness? No. You mentioned you smoke. Does anyone else in the household smoke? Yes? Okay. Do you use any marijuana? You do? Occasionally? Okay. Any family history of asthma? No? Okay. Has anyone in your family been diagnosed with lung cancer? No. Okay, great. So this patient has several risk factors and red flags for a PE or DVT, which include recent surgery, birth control pill usage, current smoker, has been less mobile due to her right angle surgery, and an elevated D-dimer. Other risk factors are obesity, pregnancy, and AFib. Signs and symptoms include shortness of breath, anxiety, chest pain, tachycardia, tachypnea, and hypotension. So diagnosis for a DVT or for a PE would be a CT scan. For a DVT, usually would be a duplex ultrasound, and the gold standard, though, is a contrast venography. It's just not done as often anymore. Patients will be treated with anticoagulants like heparin, warfarin, and Lovenox, possibly thrombolytics. In some cases, in a more life-threatening situation, a thrombectomy may be done to remove the clot. Oftentimes, a treatment for DVT and PE would be a vena cava filter to prevent further blood clots moving into the heart or lungs. Thank you.